for dissolution of Kootenai Health District. It's a discussion item. I have Joe Hazel listed as, you can come up to the table.
Okay. Thank you, Commissioner Kachari and other commissioners. So my name is Joel Hazel. I'm the Chief Legal Officer at Kootenai Health. In 2022, the Idaho legislature saw fit to change the Idaho code to allow for a public hospital district to have the same rights as county hospitals to convert to a 501c3 nonprofit under certain circumstances. I was hired at Kootenai Health after that law was changed, and I was the project lead of the conversion of Kootenai Hospital District to Kootenai Health Inc. That conversion went smoothly, and Kootenai Health assumed all operations, conveyed all property, and received all property from the hospital district on January 1st, 2024. So it's been over 2 years since it has been, Kootenai Health has been operating as a 501c3 nonprofit hospital, as opposed to the Kootenai Hospital District. At the same time, Kootenai Hospital District declared itself a non-functioning hospital district on January 1st, 2024, and has since had no assets, operations, or any function at all. Under Idaho Code, Section 39-1325, the Board of County Commissioners has the discretion to dissolve a non-functioning hospital district after 2 years of it being non-functioning. You received a letter from our board chair, Dr. McFarland, who is here and might have some comments as well, Dr. Robert McFarland. And we've listed out the pros and cons that we see, and we believe that given all the circumstances, dissolving the hospital district at this point makes sense. It is a taxing district with no function. It still has the ability to levy taxes, condemn property, yet it does not have the statutory purpose, i.e. running a hospital that is set forth in statute. I've been asked before, well, what's the harm in just leaving? Well, there is a not very recent example of a hospital district that was not functioning, yet continued to tax, and that's the East Shoshone Hospital District over in Wallace. And recall back in the 1950s, before Bunker Hill went down, there were 2 hospital districts in Shoshone, East and West. And the East Shoshone, once Bunker Hill shut down, the small hospital in Wallace also shut down. Yet the hospital district continued to levy taxes and was eventually dissolved. So there can be some mischief that goes along with a non-functioning governmental entity, and taxes for no reason, I think are anathema to what is set forth in the statute. So I would certainly entertain any questions and invite Dr. McFarland to have any questions he had. One of the reasons that we've come forward with this, in addition to just getting rid of a non-useful governmental entity where we have to have biannual elections to elect people to a position that has no purpose, is the only assets remaining in the hospital district are 2 frozen retirement accounts, which hold certain funds of former hospital district employees. The reason we did not shut those down as part of the conversion was, at the time, we were unable to, for those employees with loans, if we had terminated the plans immediately, those funds might have been taxable and might have been subject to a penalty. We have since found a workaround to that. So if the hospital district is terminated and the funds are wound down, we can now roll those loans over into the 501c3's retirement accounts. So we can do that without harm to our employees in an orderly fashion. So those reasons, we would ask that you consider dissolving the hospital district as just an unnecessary governmental entity that we don't need. If for some reason another hospital district needed to be spun up again, We do the same thing that happened in 1856 when the hospital district was formed and have it reformed by a voter petition. So I would turn over any comments to Dr. McFarland if he would like to address you, and certainly answer any questions you might have.
Sure.
These retirement accounts, do they still have outstanding loans or can you shut them down now?
They do have outstanding loans, however, we work with our ERISA attorneys and can basically convey those loans to our Kootenai Health team's existing retirement plan.
But only if the district is shut down. Can't do that apart from the district.
I have not asked that question, but it's possible we could shut down the retirement plans without this all.
And then, last time the district taxed.
1994.
So really, there isn't a worry about them taxing now. I mean, there's a lot of safeguards in place that we would know, I mean, the board would have to vote on it.
Correct.
Yes, there's a lot of hoops to jump through.
Correct. Every year, there's a line item in the agendas about deciding whether to tax. And obviously, the current board has decided to tax.
Sure, because there's no tax. Okay, those are my questions.
Any questions? Okay. I do have a couple questions. Is it because there are loans against the retirement accounts that's preventing them from being closed down?
That was the reason we did not terminate them at the point of conversion, because of the loan. We did not want.
Sure, but if the loans were paid off between then and today, would you still be able to do that? Terminate the accounts and roll them into your existing?
Probably, yes.
Why doesn't the hospital just offer to pay off their loan and then reset the loan with the employee in the new retirement plan?
That is the plan if the plan.
But you could do that right now, couldn't you?
Probably could.
So it is a reason to shut the district down, but it's not necessarily a condition. Meaning that you could pay these loans off and transfer the loan into a new retirement account. And that way it wouldn't necessarily be required in order to get that the district shut down in order for this to be possible.
I believe that to be accurate.
All right, and then just with Commissioner Duncan's comment, I mean, we can't operate on what people could do. There's lots of things that people could do that they don't do. And, we can't, police what they could do. We should only be policing what they are doing. And they're not taxing. So, Dr. McFarland, did you want to add more to this?
I don't have anything to add to Mr. Diesel's complete description, but I'd be glad to answer any other questions.
Okay, well, are there any questions for Dr. McFarland up here? Thoughts from the board?
The people of Kootenai County may be Kootenai Health. I persuaded two elected officers that went by the wayside, big farm of the bay.
Commissioner Duncan.
I think there's a lot of people in our community who were not happy the way it went down, and they didn't feel like there was enough public input when when it went from hospital districts owned and governed by the people to a nonprofit where the community's not really sought out for opinions anymore. So I am fine to look at this, but I would suggest we do a public hearing just to be open and transparent and invite the public to come and share their thoughts on it with the understanding that we do our due diligence to not allow it to expand into something that's not, that we're very specific. This is what's being requested of us. This is why, and I'm sure your thoughts. And it doesn't necessarily have to be a nighttime hearing. It can be at 2 o'clock on a Tuesday. It just depends on how much outreach we would get from the.
Well, I tend to agree in the sense that the hospital kind of converted with, the objection of a lot of the people in the community, and it is a community hospital. And, it generally works best when we get more buy-in from people as opposed to just kind of doing it no matter what people think. Um. I don't, I mean, at this point, I'm not interested in moving quickly on it. I don't have any problem getting feedback from the community. We could do that, see how that plays out. I think there is an option for the hospital to investigate, paying the loan off, refinancing that loan through a different mechanism internally so that you can pull these accounts out if it's a problem for people. It doesn't look like that's been explored completely. Would that be correct, Mr. Mason?
Not without dissolving the district first.
So there could be an option there without dissolving the district. And I think that needs to be exhausted as well. Any other comments? Okay. Anything else you have to say about it?
No, thank you for your time.
All right, thank you.
So I guess my one question is, as Commissioner Duncan suggested, you set another hearing, or what would the timing of that be? Would we need to request that?
So it sounds like we would do some public outreach first and say, are people interested in the public hearing? And we can outline, very specifically, and we can run it by you first. And then say, are you comfortable with this kind of communication? Get some feedback from the community, and then we can go from there, whether it's a 2 o'clock public hearing, part of our business meetings, we'd have to do a resolution. Or if it would be a nighttime public hearing to allow for more people to attend and speak.
Thank you very much.
All right, thank you.